Hi, I'm a paediatric trainee and I've been asked to talk to you today about the education and training domain in RCPCH Progress. For me, it's one of the domains that best encapsulates what it is to be a good paediatrician, and I think that's for a few reasons really. First of all, I think that the nature of education and training means that in order to be able to deliver teaching around a subject, you have to really understand it, you have to be good at it. And so throughout my training, if I've delivered teaching on a session, I have to say my knowledge has always been better. And that can only be a good thing both for my development and also for patients. I've been really inspired along the way by people who have taught me, whether that be people who've delivered lectures and more formal teaching, or actually people who've just delivered really useful bedside teaching or helped me do a particular procedure during my training. I can think, for example, during neonates, the first time I did umbilical lines with one of my registrars, or intubated, actually they were really important moments in my career, and those people had a really significant impact on me, and I've certainly tried to take that forward. So I think whilst those can be used, yes, to tick off the domain, actually they're much more significant because they're really key skills which you take forward and will use in your paediatric life going forward. Really, I think as well what this domain encapsulates is that we are paediatricians of the future will always be teaching and training. It will always be part of what we do. So when we finish our paediatric training as consultants, we need to be able to deliver teaching in many different settings for nurses, for other healthcare professionals, medical students, and for junior doctors in training. And so being able to do that well and have evidence of that during your training is so key. I think probably the final thing, and one of the most important things with all of this, is about our ability to teach and educate families. I can think of so many examples of why children have represented or their condition has worsened because of a lack of understanding, either from themselves or from the parents, around how to take their medication, around side effects of not taking it, and how important that really is. Children with asthma are a really prime example, or in an outpatient setting, children with diabetes. And so the way that we deliver education and that message as we are seeing children in our everyday practice is so key. So yes, it's about being able to stand up there and deliver formal teaching, but I think this really goes to the heart of what we do as paediatricians, and it's about so much more than that.